Welcome to segment 3, VACo's video magazine, VACo on the Go. With us today is Betsey Daley, Staff Director of the Senate Finance Committee. Betsey, thank you for being here and being a part of VACo's video magazine, VACo on the Go. I know this is probably one of the busiest times that you're involved in. We're past crossover, working on a budget, trying to get a budget out.
Right.
And can you tell us a little bit about the process, where we're at right now?
Sure. Yeah. As you know, we have a parallel process. The Senate puts together a budget, the House puts together a budget, and we come together in this great crescendo of conference where we try to iron out the differences. So that's where we are right now. Technically, the House and Senate each rejected each other's budgets yesterday, so we are now in a committee of conference. And informally, the group has already been getting together and having some conversations. We've been briefing our members on the differences in the budget, and just trying to, in a very low-key, very cordial way, talking to the House members and just getting to know each other. They have a few new members, we do too. So that's where we are. And the objective is to finish the conference process sometime next week. It's a little open-ended because of a change in the procedural resolution this year. But hopefully they might have a budget by sine die on March 8th.
Optimistic. That's great. Now, the role of the conferees in this whole process, exactly what is that? I mean, are they just trying to hammer out the differences?
Absolutely. It's very nuts and bolts. They're down, $20,000 all the way up to $50 million decisions, and they go through each line and look at each choice that the House and Senate has made and literally reconcile the differences. A lot of times there's language that's very problematic, and they spend a lot of time hashing through the differences in terms of philosophy and the intent of what the language amendments might be. So it's a very labor-intensive. We really don't allow enough time for the level of decisions that have to be made. And we've probably gotten a little bit away from a more staff-driven conference. Back in the olden days, the staff would probably do more of it and bring the tougher decisions to the members. Now the model is a little bit more that the members are involved in the entire process, even down to some very easy low-level decisions. So they are definitely on the ground, working hard the whole time they're in conference.
Well, Betsey, I know you've been working with the competing budgets, the House budget and the Senate
Right.
budget.
Mm-hmm.
Can you tell us a little bit about what's in that Senate budget, especially for local government, how maybe K-12 or some of the other
Right.
things will be impacting should the Senate budget prevail?
Right. Definitely the Senate budget is stronger in K-12, and that's typical most years. I believe our budget has total funding of about $14.3 million additional funding over the budget is introduced for K-12, whereas the House is negative $40 million. So that's a pretty big swing. And that's a little confusing because some of the negative number that the House has, it's some lottery funds and some literary fund revenues that become available and then can be used to reduce the general fund. So, but suffice it to say that inflation, we both have cost of competing funds, but the Senate has a pretty large contribution toward inflation, which was removed from the budget as introduced. Some K-3 class size funding, pre-K, a number of initiatives such as that. And I think altogether, while our group did not fund a teacher salary increase per se, there's probably enough funding in the first year to fund roughly a 1% given these various pots of money in the Senate budget. So that's clearly the biggest difference I think between the two budgets is in K-12.
About $50 million difference.
$50 million swing.
Looking at the end.
Yeah.
As far as other programs, I know that in Senate Finance has worked very hard with jail funding, 599 funding, police
Right.
funding, and has led the efforts in trying to look for additional dollars, I guess, to localities in that arena.
Yeah, absolutely.
Tell us something about what the Senate budget what the proposal is.
Definitely in public safety, we do have additional funding, 599, as you mentioned. We were glad to see that Governor McDonald included funding in both years for that. I believe the House removed the second year funding, but that's been something that our committee has definitely pushed over a number of years to try to get that 599 funding back. Also, good support for state police, our com board positions, funding for deputy sheriffs through some compensation actions. Trying to think of a few other things. I guess those are probably the major areas.
Jail per diems.
Oh, how can I forget jail per diems?
One of our biggest
Right. That was missed in, the budget is introduced in FY14, and we funded it, and the House, I can't, late breaking news here, but in our conversations about the caboose bill conference on that, the House has agreed to fund that, I think almost $5 million on jail per diems. There isn't additional funding in 15 and 16. I think that is a major issue that we're going to have to look at next biennium.
Well, I think the whole was about 4.8 million, wasn't it?
That's,
In House Bill
right,
29.
in 14,
Yeah.
this current year.
Great, great. One of the biggest issues I think that you all are wrestling with and trying to come to terms with is the health care for poor people, health care for many of the people that may be Medicaid eligible. I know that the Senate has a plan called the Marketplace Virginia. The governor also has a plan on full expansion of Medicaid. And I know the House has been very adamant in trying to reform pieces of Medicaid and not doing any type of expansion. Tell us a little bit about the Marketplace Virginia and how that will impact this whole budget process.
Okay.
What do you think about it?
Well, the key thing about Marketplace Virginia is trying to address this coverage gap. And thanks to the Supreme Court ruling a few years ago, you have individuals in Virginia, roughly 200,000 or so, who are too rich for the conventional Medicaid program that we have, but yet don't make enough income to participate in the subsidized marketplace that is run through the federal exchange. So, these individuals they're generally the working poor, a lot of them are veterans, and they will have no access to coverage under the House's proposal for the foreseeable future. What the Senate has proposed is trying to be a little more public-private oriented, a private sector approach, and finding a way to let these individuals buy in, almost as if they were in this upper range of the buying into the subsidized insurance, and as opposed to just a conventional straight-out expand Medicaid. There's some skin in the game, if you will. There's some co-pays. There would be some requirements for seeking jobs, a few things like that, and working with the private health insurance plans, trying to bring a little different spin to providing access for these folks. And Senator Stosh on our staff, on our committee, and Senator Watkins have both really poured their hearts and souls into this and tried to be very innovative in a way to have it appeal to the citizens of Virginia, and also try to get some interest from the House, quite candidly.
Betsey, one of the issues that I have really not heard a lot of discussion about, and that's really the process. Should Marketplace Virginia be adopted? The process of determining eligibility, managing eligibility long-term, knowing that these are Medicaid funds. I know that there is some dollars, or has been some money in the budget, the Senate budget, or maybe it's the invoice budget, for eligibility workers. Do you know can you shed any light on that as far as the impact it's going to have on locals? I know that in meeting with many of the House members, they're very concerned about the impact on eligibility.
Right.
And I've heard some different views from the senators on this.
Well, we just had a conversation on this topic with Bill Hazel, Secretary of Health and Human Resources, the other day, and he did acknowledge that it would be a burden on the local social services offices to have to deal with this additional influx of 200 or so thousand individuals. So that is definitely we're aware of the issue, and we're working to figure out a way to handle that. I don't know the ultimate solution at this point, but everyone is definitely aware of it and sensitive to it, and will. I think there are probably sufficient funds to be able to address that in some of the savings and some of the dollars that have been made available for some of these issues.
I know that I think that from understanding what's been happening with the budget this past year, some more money has been put in for technology, for software packages
Right.
that would make the whole eligibility process a little bit easier, a little bit less cumbersome for localities. And so, we really hope that does take effect.
Yeah, I think so too.
Well, thank you for being with us and sharing with us some insight into the state budget and your process. I know it's a tough time to try to steal 15 minutes away from your duties, but thank you for being with us in VACo on the Go.
Happy to do it, thank you.
Thank you.